In this video, we're talking about some of the more overlooked gynecologic cancers out there. They may have subtle symptoms. These would be like irritation, itching. A lot of people are told, well, that's just a part of that area getting older. However, vulvar, vaginal cancers, they are a real thing. And don't just ignore the symptoms. We're going to talk about them in just a second. Again, my name is Eric Schmidt. I'm a board certified OBGYN. This is part of a video series where we're trying to raise money for gynecologic cancer research. And we talked about cervical, we talked about uterine, we talked about ovarian. We're talking about some of the less known GYN cancers out there, of the vulva, of the vagina. Combined, they only have about 9,000 cases per year in the United States. The link for the fundraiser is below in the description. If you're able to leave a small donation, that goes a long way. And thank you for everyone that's already donated to the cause for gynecologic cancer research. I saw those donations. I didn't expect to see as many as I saw, so it really actually made me feel pretty good to see that there are so many people out there that care about this topic. So quick anatomy review. Let's talk about the vulva. This is the area that in the skin surrounding the vagina, the opening of the vagina. And this would include things like the labia majora, minora. This would include things like the clitoral region and the perineum. This is where some of these potential irritations, maybe cancers, can arise from. And then there's the vagina, which, as we know, is the internal part of that. And in this canal, along the skin of this area, there can develop also precancerous and cancerous changes that, well, if left unchecked, could develop further. Now, we're talking about primary cancers of this area. There are certain other cancers like cervical, endometrial, where they grow in those given areas and then grow to the vagina or even to the labia, and that is just a more advanced stage of that own cancer, and it's a part of the staging and all that. But specifically, we're talking about primary cancers of this area. Let's go over some of the signs and symptoms to watch out for in each of these different types of cancer. Both of them might have some overlap, but we'll break them down individually. Let's talk about the vulva first. That area has a lot of different things that could potentially affect the sensation in that area. But if somebody is having itching, irritation, chronic, not just momentary, but over again, nothing is helping, changing the things that are touching the area, the soaps, that's not helping. You want to get this checked out. And your doctor is going to want to do an evaluation, because that is one of the biggest symptoms and the signs from this type of cancer that we have to detect it. You can also start to see skin changes in this area, specifically any raised lesions, or if you're feeling any bumps, specifically where that irritation is, you want to get that checked out, potentially biopsied, as that could be a sign of these underlying cancers. One risk factor for this squamous cell cancer of the vulva is lichen sclerosis. We see this actually quite a bit, lichen sclerosis. It is usually postmenopausal women, and they have this whitening and thinning of the tissue and has some irritation too. And we'll put up an image here. This isn't any specific raised lesion, but when we look at it with the naked eye, we can already see some whitening of that area. And often, while this is a benign process, about 5% of the time, there can be an underlying squamous cell cancer of the vulva in that area, and which would require biopsies or something like that, or colposcopy to look at closer under a microscope to see if this area is of any concern. And I've personally seen a few different presentations of this type of cancer. A lot of times there might be a raised lesion. And so if you're feeling anything different, or an ulcerating lesion, or we call it almost fungating looking, you definitely want to get these checked out and biopsied. Now let's talk about the vaginal cancers. These often might have a little bit different of a presentation for signs and symptoms. Often we see potential bleeding, specifically maybe even bleeding with sex, that is irritating that area and potentially giving some of these abnormal blood vessels that are growing with these precancerous and cancerous lesions. They often will bleed if touched, and so that can be one of the biggest signs. And so not only are we looking out for things like endometrial cancer, the big, the thing that is what we look out for when someone has bleeding after menopause, but yeah, and you do the ultrasound and the lining is thin, you want to check the area for other sources of the bleeding within the vagina to make sure you're missing nothing, because sometimes you get a little tunnel vision and you only look for that endometrial cancer in a postmenopausal woman who's bleeding, but no, you really want to evaluate the whole area, again, the vagina, the cervix, the outer tissue labia, and urethra, to make sure there's no other lesions that someone might be missing. And certainly, discharge can be normal. However, if you're having a new discharge, like a watery discharge, bloody discharge, you want to get this checked out so you might make sure you're not missing anything like this. All right, now let's talk about the risk factors so you can hopefully reduce your own risks. Well, as we talked about with cervical cancer, these are really HPV sensitive cancers, that it's doing a lot of these changes within the cells to turn them abnormal and to start that precancerous and cancerous changes. So HPV is one of the biggest risk factors for vulvar and vaginal cancers. It's also part of the reason when we're evaluating somebody for abnormal pap smears with colposcopy. We say colposcopy of the cervix, but really it's like the upper vagina and cervix we're really looking at. And we're going to talk about this actually in a video within the next couple of weeks, but why someone doesn't just get a hysterectomy for abnormal paps and HPV is because, well, and the upper vagina is also affected by this. So, just removing the uterus and cervix doesn't completely solve the issue. Next big risk factor, and this is for vulvar cancers, is the lichen sclerosis. Again, it's a benign process. However, underlying squamous cell cancer can arise from those areas. That's why we keep a close eye on it, especially if it's not getting better with the steroid creams or if it's all of a sudden getting worse. Despite the use of the steroid creams, definitely wanting to see your doctor, potential biopsies at that time. The biggest risk factor for both of these also too is age. We see these generally in women in their 60s, 70s, although, we still can see it earlier on than that. Even some of the precancerous changes, we call VAIN, so vaginal cancers, or VIN, vulvar intraepithelial neoplasia, those are the precancerous terms, can happen even in someone's 30s, 40s. And so that's why every symptom, we take seriously, we do the correct workup, and maybe even have to do biopsies earlier on to detect those. Big surprise here, but smoking is a risk factor. And so if you didn't hear it in my prior videos, don't do that. It increases your risk for so many things. So moving on. And of course, if someone has immunosuppression for some reason, well, they're taking medications to suppress their immune system, they've had a transplant before, other things that cause a suppressed immune system, you also want to pay close attention to these symptoms, as you may have slightly increased risk. All right, so what do we do to prevent all that? Basically the opposite of what we just talked about. So HPV vaccination will decrease your risk for both of these cancers. Close monitoring of those precancerous lesions of the vagina and the vulva. We talked about the VAIN, the precancerous lesion of the vagina, VIN, precancerous lesion of the vulva. Something we take seriously, we watch closely with things like colposcopy, potential biopsy. Hopefully with proper anesthesia, these procedures can be hopefully done easily in the office or maybe even the operating room setting. Kind of a big question too that we're facing as a profession is, well, does a person need an annual exam with their gynecologist? Now, again, if you're paying attention to a lot of these symptoms, hopefully you can catch something early yourself, but getting an external and internal exam, and it doesn't have to be necessarily your gynecologist, someone, especially as they're getting into the 30s, 40s, beyond, they should have yearly visits with either their primary care doctor, and if they wanted to double up with their gynecologist, they could, or just see their gynecologist every few years, or if there's any concerns. But yes, early detection that way is also key. So that wraps up our gynecologic cancers. Again, this is a fundraiser series, so if you don't mind, there's a link in the description below, and if you're able to give a small donation, that goes a long way. Thank you for all those that have. It means a lot. It's great to see that with only, we're about a week through this month and this series, so thank you everyone for giving those donations, and we'll talk to you in the near future. Everyone have a great day. Have a great rest of your week.